Thank you to the AUA for allowing us to present this data, and thank you moderators for dedicating your time to this session. I'm going to be speaking about the use of 3D printed hydrogel models, not so different from the last presentation, only a different process. And these models were developed for surgical training of artificial urinary sphincter and inflatable penile prosthesis procedures. And I'm presenting this on behalf of my co-authors, Dr. Joe Madden-Fuentes and Steph Gonzales. Here's my disclosure. So how can we train in surgical procedures while also ensuring the anatomy and tissues mimic the real thing? Always been a big challenge. Giving the opportunity to a large number of people, and the increasing the accessibility by having flexible training locations. So the current, as you heard from the previous speaker, the current options for surgical training models typically include models made from animal tissues, which can be expensive. There's sensitivity about using animal tissues, and you have limited locations. Cadavers are very expensive. They represent a biohazard. You can only do it in specialized laboratories. And so there are alternative methods, which I will speak about, that are more affordable. There is no issue in waste concerns. They can be used at any location, and specifically, you can customize the pathology. So we developed a realistic anatomy and tissue design for prosthetic procedures. Its use is not limited to a lab or a specific location. It is less costly compared to animal models and cadavers. One model can accommodate 3 different procedures in this iteration. So what we studied was the use of the phantom, the penile prosthesis phantom, to implant an inflatable penile prosthesis, both in the penile-scrotal and an infrapubic approach, and to implant an artificial urinary sphincter in the perineum. So one model designed for 3 different procedures. And we validated the model by using voice of expert at an event where there were 5 voice of experts and residents in training. There were faculty, they were 8. And as you can see by the scores, the validation for how valuable the hydrogel model would be for a physician new to the IPP procedure, how realistic the hydrogel model tissue is to live human tissue, and how realistic the hydrogel model anatomy is to live human tissue. So the scores range from 76 to 92%, slightly higher for expert surgeons on the tissue characteristics, slightly higher for the residents and faculty on the anatomy, but overall fairly high scores. So in conclusion, 3D printed hydrogel models can realistically mimic tissue and anatomy, achieve a fully functional implanted prosthetic. As you can see on the right, you can inflate the penile prosthesis to replicate what happened in a patient. They have high validation scores, and they also create a safe environment for newer urologists to practice, increase the number of physicians who can train on new procedures in a safe environment. Thank you.
Questions? I have a question. How much it costs to print a model like that?
So this is a process that, the way it's made is you print the cast, the mold, and then you fill the mold with substrate, which is managed in a certain way, and then that substrate creates a part of the phantom, and then you hand assemble it. So it normally takes, depending on how complex the model is, could take less than a day to 2 weeks, depending on the complexity. And the models typically range in price from around $300 to $2,500, depending on its complexity.
When you were doing the comparison of the expert surgeons and the residents faculty, why was the 1 out of 6 and 1 out of 5? I was just wondering.
That's the way, I didn't put the survey together. It was put together by the company, so you're right, they should probably be the same score.
No, I'm just wondering what your question was.
And the numbers were also small, they were only 13, I think, so in the future there'll be 1 Likert score,
Yeah.
and there'll be many more physicians, but it was a start.